mostly fall into my area. And so we're excited to be able to show you what we have here at Novant Health. And of course, any questions that pop up, we're available. We want this to obviously be a conversation as we go, but thanks again.
Thanks, Ryan. Stephanie?
Hi, Stephanie Fontanella. I am on the Novant side as what we call a Dimension Solution Manager. So part of my role is really just bringing the different Epic applications together for integrated work and just keeping updated with all of our latest and greatest that's coming from Epic.
Thank you, Stephanie. Michelle?
Hey everybody, my name is Michelle Drohan. I am the manager here at Novant Health for the MyChart for our patient portal. So you will get to hear from me a little bit later today when I demonstrate our patient portal. So looking forward to it. Nice meeting everybody.
Thank you, Michelle. Myron?
Hey, good morning. Myron Colson. I'm a director of clinical applications, mostly in the acute space. So I have all of the Epic modules, ClinDoc orders, Beacon, etc. And welcome.
Fantastic. Thank you, Myron. Tiffany Fouché.
Good morning. My name is Tiffany Fouché. I'm the manager of the Community Connect team here at Novant Health. And good morning, everyone.
Thank you, Tiffany. I see Kim Postles. Kim, good morning.
Good morning. I am Kim Postles. I am the team lead for the professional billing for and cadence for Community Connect.
Thank you. Dave Odell.
Morning, everybody. My name is Dave Odell. I'm actually with the Novant Health Community Connect team, working on the clinical side as the clinical team lead. I'll be actually working a little bit later this morning, walking us through office visit functionality on the outpatient side and explaining some of those features. So it's nice to meet everybody. Thank you.
Thank you, Dave. Sarah Sandoval.
Hey, good morning, everyone. My name is Sarah Sandoval. I am on the Community Connect side, Cadence piece, which is all about registration and scheduling. So I'll be demoing later today.
Fantastic. Thank you, Sarah. Piper.
Hello, good morning. My name is Piper Nedning. I am a professional billing and claims and electronic remittance analyst for the Community Connect team. Good morning.
Excellent. Thank you. So team, you've heard Community Connect several times. And so just to set the stage for the audience, the Huron and the Hugh Chatham side, Novant Health has been delivering our Epic Dimensions platform as a service to providers and community partners here for 8 years now. And so what is Epic as a service? What is Community Connect? It basically is a capability that Epic has enabled for large hospital systems to be able to extend their instance of Epic, their EHR, to other community partners. So we have been, this team and many of the folks on this call have been involved since the onset in delivering this service to, we have 30 to 40 different client partners that we collaborate with in delivering this service day in and day out. And so what you're going to see today is a demonstration from our core Dimensions Epic team that delivers Epic internally to our Novant Health network, as well as demonstrations from the team that is dedicated to delivering the Epic platform as a service through the Connect platform. Did I miss anyone on the Novant Health side before we transition over to the Hugh Chatham and the Huron team? Going once, going twice. Okay, I'm going to hand it back over to you, Ted, for intros from Huron and Hugh Chatham. Thank you.
Great. Yeah, thank you, Marcus. Appreciate all those introductions, and we're really grateful for everybody joining this call and going through this demo with us. So I already introduced myself, so thank you for that. And Mary Blackburn, I see you're on the call. If you don't mind, go next.
Sure. Good morning, everybody. And again, thank you for joining us at Hugh Chatham. I'm Mary Blackburn. I'm the Chief Clinical Officer here. So responsible for most of the things within the hospital walls clinically.
Great. Kent?
Yes, my name is Kent Thompson. I'm the Chief Financial Officer here at Hugh Chatham. Me, along with our Chief Medical Officer, Dr. Jonathan Snyder, are the executive sponsors of the EHR selection process. So we do appreciate your time today. We're excited about what we're going to see, and just thank you all for your efforts in being here with us today. Thanks.
Yeah, and without going through everybody on the Hugh Chatham side, Andrew Tate, I see you're on the call if you're able to unmute.
Sure. Andrew Tate. I'm our VP of Ambulatory Services and our Chief Practice Officer. So responsible for all things outpatient related, along with lab and imaging on the inpatient side.
Yeah, Marcus, I don't see anybody from Huron. There's a lot of faces here on the list, but I think we're good on our side in terms of introduction. So feel free to go ahead and take it from here.
Yeah, thank you. Ted, do we have the agenda up? Can you share? Ted, do you have that at your fingertips so everyone can kind of just
I sure can.
quickly
I sure can.
take a
Give me a
view of the
second.
agenda, and then we'll dive in.
Yep. Might be a little small there. Give me a second.
Excellent. All right, well, wow, we're right on time with introductions being complete, right at 8:10 sharp. So we'll jump right into the demo. I see general system navigation. Let me hand it over to the Dimensions and Community Connect team. Who do we have on point for general systems navigation? Okay.
So Marcus, so the application teams that have joined really start at the provider and integrated section, which is slated for 8:30.
Okay.
I'm not, I'm not 100% sure maybe what we want to see for general system navigation, and we could do something. Otherwise, we could just jump right into the demos.
Yeah, I think that navigation is going to become clear as we start going through the demos. And then, of course, if there's any questions about it as we go, we've got the right group on to answer those. So.
Excellent. Thanks, Stephanie. Thanks, Ryan.
So I think, Dave, that would put you ready to go.
Yes, that sounds perfect. Let's see if I'm going to go ahead and share my screen. Right. Okay.
You see it?
Everyone can see my screen at this point?
Yes, sir.
Thank you so much. Appreciate that. All right, once again, my name is Dave. I'm with the Community Connect team, and what I'd like to do this morning is give you an overview of some of our outpatient workflows on the ambulatory side. I'd like to kick it off with an office visit for our test patient. So right now we're in one of our test environments here. I'm logging into our test environment into Epic Hyperspace. In order to kick things off, I'm gonna log in as a generic test user. So I'm gonna go ahead and log in as a test nurse/MA. Kick things off. I'll enter in my credentials, and it'll ask me in this particular instance for my job title. Yes, I am working on the ambulatory side, so I'll simply continue. Here I have the ability to actually choose the department I'm logging into, especially if I work, across multiple facilities or multiple practices. I have that ability to change, assuming my security has that access granted. So I'm going to be logging into this family medicine group today here at FMG. So we'll go ahead and click continue and bypass the message of the day. And it's going to open up to my home workspace. So just a couple key things I'd like to call out once logging in. Just to verify things, at the very top of my screen, on the gray banner at the very top, and notice that it does display that I'm logged into FMG Family Med, the test environment, and of course, then that is my name, or my generic test user's name. So everything looks good there. I've got my top menu bar with the Epic button on the far left, which has a series of drop-down items for me to select. Below that, in that blue banner, I do have my home workspace. So I've got my workspaces that are already defaulted. I do have my dashboards, which do pop up. They give me some widgets and different components that allow me to access different parts of the system, whether it be my schedule, in basket, communications that I need to look at or address. And then to the right of that, I have access to my schedule, and then of course my in basket. So these are your primary workspaces that we have. But since we've got our test patient, and I believe he's already checked in to our department, and he's waiting patiently in the waiting room of the practice, what I'm going to do as the nurse MA is I'm going to go ahead and select my schedule workspace. And from here, I have my own personal schedule, but I haven't really set that up, which is no worries. I know that I'm working in FMG Family Med, so I'll just select the entire department schedule for the day. And once again, we do have our patient, Hugh Chatham, here on the right-hand side. So based upon the information that we have highlighted here on our multi-provider schedule, you'll notice that there's a series of columns that are there and very helpful for me to see. The very first column is actually almost invisible. And this column here is a series of dots, and it's a color-coded system. So arbitrarily, each organization can decide how they use these colored dots in terms of, once the patient's roomed, whether it be if they were roomed in exam room 1 or 3, we can use these indicators to let the staff know that, okay, this patient is in fact ready to go in exam room 3. So the only colored dot that I will mention, and I might mention it later in this demo, is the blue dot. We use this in the logic behind the scenes to trigger notifications to nurses and MAs and support staff whenever, for example, point of care tests or tests within the office will need to be performed. That way, they'll see a notification that, hey, for this patient, there might be something that I need to do during the visit. So having this on the schedule and the fact that the nurses and the MAs and support staff do work off of this particular screen, it's a great notification piece outside of, passing the provider or clinician through the hall. Most importantly, I think, is our status. Now, we had noticed that we've got the status of arrived. So that's telling me that the patient has been checked in for this particular appointment. So they've been to the front desk and they've gone through that process. If they hadn't been through the check-in process at that time, the status would have been scheduled. But it clearly tells me exactly the time that that patient was checked in. So I've got Hugh Chatham. I've got my date of birth to confirm that it is Hugh. And he was actually seeing his PCP, Dr. Hammonds, today. So on this note, I'm ready to go greet the patient. We'll go ahead and grab the patient and walk them back into the first exam room 1. So assuming we've got everything that we need, the only thing I need to do to click off the clinical encounters is simply double click on this highlighted patient to open the encounter. So we'll go ahead and do that. Sorry for a little bit of slowness. Okay, so right now at this point, we are actually into another workspace. So the system has already added an additional patient workspace next to those other icons. And over on the left-hand side, in terms just to set your eye, on the left-hand side, we have our storyboard. So on the outpatient setting, you're always going to see the storyboard on the left-hand side. It'll give me some key pieces of information, whether it be the patient's name, their MRN, and it looks like we've got a birthday today for our test patient. So happy birthday, Hugh. Other icons here is we have access to sticky notes, which could be used to put a personal reminder about the patient. They're typically not discoverable, and only I, as the provider, can see that. So if somebody were to log in behind me, they cannot see that. Also, I've noticed over here with some icons that the patient might have been seen outside of our Epic instance and perhaps has a chart elsewhere that I might be able to pull some information from if I need to. And last but not least, oh, it looks like this patient is a MyChart active patient. So that's definitely a plus, the fact that we can communicate with them through the MyChart portal. So as you notice here, it does give you a summary of some key features about this patient. But really, working from left to right, once again, when I'm in the encounter, the other key piece here is making sure that I'm in the right visit. So I do notice it's today's date with Victoria Hammond. So I know that I'm not documenting potentially on a patient in there. But when you open the encounter on the outpatient side, you'll typically have access to a snapshot report, which really just highlights different aspects of the patient that we have here today, whether it be his allergies, problem list, demographics, so on and so forth, and quick links to access that information. But from chart review, we're really going to have an opportunity to see whether I be the nurse or perhaps if I'm the provider. Within chart review, it's going to show me all of the visits, whether it be outpatient or inpatient stays or ED admits that this patient might have specifically on our Epic instance. And in some cases, you might actually see a little carrot everywhere symbol. And this will tell us a little bit more about encounters that are outside of our walls that we can still see some highlighted clinical information. So if they've been seen within Epic, we'll have the benefit of seeing the whole story, which is a really nice feature. But once again, we've got our rooming, our planning, our ambulatory tools, which has a series of clinical flow sheets, wrap-up tab, and some other auxiliary tabs over here on the right-hand side. And of course, depending upon what we're looking to accomplish today or what our needs are, we can't necessarily have everything on the screen, so we do have additional tabs and activities on the right-hand side, but our most commonly used ones are definitely here. So as the MA today, I'm really just going to handle the rooming. Since I've got Hugh in the system, or got him in the exam room number one, he went ahead and actually has told me that he's been dealing with some issues. One of which that he's had a sore throat for the last few days. So I'm going to go ahead and add the reason for visit. And if you notice here from the rooming tab, I can either work from top down, going from visit information down to the vital signs, or I can work from left to right here through these navigator sections and really access the sections that I need based upon my clinical workflow. The patients also noted that they've been a little bit fatigued over the last few days. So here I have access to these little speed buttons, most common reasons why the patient might have come in. What's great is that I do have a little wrench here, and I can edit these speed buttons as an end user, and I can put those most commonly used items here. But, so sometimes, less is more in terms of the reasons for visits, but if you're not finding what you need, you can always search the database. The other item that our patient has been complaining about over the last couple of weeks, but really hasn't addressed it, is he's actually having some hearing problems. And he's having a hearing problem in the right ear. So if you notice down below, as I add these chief complaints, sour throat, fatigue, I actually have the ability to add a comment. So I can be even more specific as to what's going on with the patient. And then from there, we can then jump over to our vitals. So for our vital signs today, I'm going to say the blood pressure is, for the most part, right where we need it to be. We'll go to the temperature. We'll do the spike temp. We'll just say we did this orally. There we go. Of course, I have the ability to add the height and the weight and some other key information. But I noticed that he was really complaining about that right ear pain that sort of comes and goes. So I'm going to go ahead and document his pain score. And so based upon on things that have been going on the last few days and with the sore throat. He's saying that really it's sort of bothering him a little bit more than usual. So we'll go ahead and accept that as well. I do notice that somewhere else in the system that it's been documented that he's never smoked and has never used smokeless tobacco. So I've gone through the process to confirm, we can confirm with him. As we're going through these key components as the MA or the nurse, you'll notice that it'll let you know when it was last reviewed by a provider or a clinician. And it looks like since we've asked that question and we have, validated that things have not changed, we're going to put this as marked as reviewed so that it puts a date and timestamp showing folks that I've actually addressed this section and really nothing has changed for this provider. So when I close the section, when I document in the section for the first time, a really nice feature within Epic, if I jump back to my schedule, you'll notice my status has changed. So everybody in the office, those working the front, know that rooming was in progress. I'm beginning to document, and I've actually got the patient in the exam room. Now, mind you, this is my laptop, so I've named my workstation my first name, Dave, but this could be exam room 1 or exam room 3. So you clearly know, and the provider clearly knows where Hugh is in the process of the building, in the workflow. All right, so we've got our vitals. We're gonna go ahead and just sort of work from left to right here. We're gonna go ahead and address our allergies. It looks like our patient has an allergy to cat hair extract. They've gone ahead and confirmed that. I'm gonna go ahead once again, I'm gonna click on mark as reviewed. If I did need to add a new allergy, whether it be latex, so on and so forth, I can certainly search the database. So we're good there. Moving along to medication, I'm not going to address and ask the patient exactly what medications that he or she may be taking. And I noticed within this section that the patient is taking a low dose aspirin. And I've confirmed that they are actually taking, as of this appointment, as well as their glucophage. The one thing that does catch my eye is that as I'm queuing this up for the provider to see the patient, just in case he or she would like to e-prescribe a medication and have that sent over to the pharmacy, here I noticed that I don't have a patient's pharmacy listed. So typically you can catch that up front. A lot of the patients that are already in the system have multiple pharmacies listed. So it's just a matter of during that check-in process, rooming process, actually confirming where they potentially would want a script sent if one was going to be written for this visit. But I'll go ahead and show you this functionality. Let's go ahead and quickly just add a pharmacy for this patient. So this patient lives outside of Greensboro. So I believe the zip code 27403 actually should work. I have to make sure I get that in the right field, folks. All right. So here we have a CVS pharmacy here in Greensboro on Florida Street. And he was such a good guy that he is perfectly happy to use this CVS. All right, so we're gonna go ahead and select him. That's his primary, and we'll click accept. So here we've had the ability to add the pharmacy, and it'll give us some additional information. So we're all queued up and ready to go in terms of the meds and making sure we do have a pharmacy, saving some time down the road for our new patient. Nothing else has changed. I certainly should click mark as reviewed. Last but not least, another key section to discuss is the history navigator section. So in the outpatient setting, depending upon your specialty, here in this instance, we are in family medicine, so we might see a more broader category in terms of options for us to choose in terms of the patient's past medical history. But this is customizable, especially if you're working in a gastroenterology clinic or pain management. Some of these items that are displayed can be configured for that specialty. So this is a really nice time saver. For the sake of this demo, I'm not going to add any additional history items, but you'll notice that the patient, it's been documented they do have some issues. If I don't find anything here on my list, so for example, let's say they've had a history of dealing with kidney stones or renal calculi, I noticed it's not a button. That's no worries. We can just come here and actually search for renal calculi, and it's going to search the ICD-10 database. And I can quickly add that to the medical history. So if you're a code person, you happen to know the codes, that's a great thing. If not, root words will get you closer to the diagnosis you're looking for. So for past surgical history, you'll notice that we've got some past surgical history for this patient. Once again, if we're not seeing a particular item, so let's say, for example, for that renal calculi, maybe this individual has had lithotripsy years back, we can certainly search for lithotripsy, and it should search that CPT4 database for those items. Family history, we can document the patient's family history and what's pertinent. So in this example, we've got mom dealing with some asthma as well as a sister. So we've got some asthma in the family. And as we scroll down in this section, which is a little bit lengthy, once again, we have an opportunity to document social history, whether it be tobacco, alcohol, substance, sexual activity, and other items of that nature. So from this point on, since I've gone through this process, I certainly want to wrap things up and indicate that I've reviewed this section and I've updated things accordingly. So we've gotten our history section documented as well. So at this point, I've completed my tasks as the nurse, as the MA, and the patient is ready to be seen by the provider. So when I'm in that exam room, really the only thing that I need to do is up here in the top right-hand part of my screen, you'll see a secure and a log out button. I certainly can log out of the system, but it's going to bring me back to the home screen and whatnot, and I'll lose the patient context of which patient's chart that I was in for the next person, or if in fact I come back into the exam room later and I need to pull up each chart. The best thing to do is to use the secure feature. And what the secure feature does is, of course, it's going to secure the screen and it's going to leave that patient's chart up in the background. So the next individual that logs in to the exam room and logs in, they should be able to open up that patient's workspace and continue. So you notice that I've got the session is secured. I'm done as the MA. So now I'm going to log on as a test provider. So I'm going to go ahead and key in my username and my password. To log in, it's indicating my job as an ambulatory provider. That is accurate. We're going in, and if you notice here, my screen jumped. My apologies. Can you still see my screen?
Yes.
Yes.
Thank you so much. All right. So as you notice here, I'm logged in as at the very top of the screen, once again, to draw your eyes to the gray banner, FMG Family Med, and I'm logged in as my generic provider. So I know I'm in the right place. And if you notice here, I also have the same Hugh Chatham workspace up. Now my express lane is defaulting, but we're gonna go ahead and exit that screen. I'm not gonna work through express lanes today. If you notice here, we are actually now within the rooming tab. And a lot of the information that our MA has documented is visible here. But, you know, really what the one thing that I should mention in terms of the workflow is that, and my apologies, is that whenever, right before the MA secures the workstation, I know we talked about the DOT system. We could possibly select green if that's what the practice is deciding to indicate to the provider who might be looking at the schedule, but let them know that Hugh is ready to go for them. So at that point in time, they'll see that patient Hugh is ready to go. That's one key feature going back to the dots. All right, so our patient's ready, and we've got the rooming section. We've had an opportunity to discuss with you that he is dealing with a sore throat. So clinically, we're going to make a decision to run a quick POC test for strep, dealing with some fatigue, and then the hearing problem that he mentioned with the associated pain. We're not really sure if that's due to the sore throat or possibly the infection, or if there's got something else going on. So We'll go ahead and address those different items. But if you notice here from navigation, once again, we've got our storyboard. We have our chart review, our rooming, and from here, we're going to go ahead and pull up our notes section. So with all this information here on the left-hand side, on the right hand of my screen, you'll notice I have basically a sidebar, a taskbar, if you will. I've got this visit, which shows me basically an ambulatory sidebar report that summarizes a lot of the information that we've documented thus far in this visit. We have a notes tab. And as this launches, it defaults to one of our general SOAP notes or smart phrase format. The one thing I want to mention about this particular smart phrase, this template that's available in the system, if you notice here, we've got a subjective part or a subjective piece. And if I hit my F3 button, I should be able to zoom in, and hopefully this will be a little bit easier to see. You'll notice that we've got a lot of information already defaulting in, and it's highlighted with that blue backfill. That is discrete data from this visit being pulled in to today's note. So Epic through SmartLinks has the ability to pull this discrete data in. You notice here we've actually already pulled in a chief complaint, some of the items off the active problem list, our allergies, so on and so forth. So from this perspective, a note has already taken shape, and we're ready to sort of continue with our assessment and plan. All right, so one of the things that we may do, and it just depends on your workflow, but we're going to have the provider place this order today. We're really concerned about that sore throat. So down here in the bottom left-hand corner, I have the ability to place my orders for strep. So I'm going to do a quick point of care test. And if you notice here, we're going to select our rapid strep A. On the bottom hand of my right-hand corner of my screen, you'll notice that I actually have the order displaying as well. And I have the ability to associate the diagnosis or actually simply sign the order. In the interest of time, we know that he is dealing with some ear pain. After talking with him, we feel that it's best that probably after we've resolved the sore throat issue, that we probably are going to want to send him over to a specialist. So I'm just going to save some time, and I'm going to actually order ambulatory referral to ENT. So when I enter in, I can find my order, click accept. All right, so the order composer pops up. I'm going to just complete a couple key fields, if you will, to go ahead and process this order. So an internal referral is actually one within the Novant instance, within the Epic instance. However, when talking to Hugh, he's not really sure where he's going to, or which specialist he's going to see. So we're actually going to set up an external referral and make sure that we have a referral and a requisition to print out for him. We're going to actually have this for evaluation and returns. And of course, you do have the ability to enter in some additional reasons for referral, or in fact, actually any comments that you might need for that provider. So we're going to keep things simple. We're going to click accept. I'm going to go ahead and sign the orders. All right. So we're going to go ahead and continue anyway. We've on this test patient have ordered a few different orders a few different times. So that's why we're getting that pop up, and no worries. So in this instance, I have the ability to add my diagnosis. So it won't let me sign my order without that diagnosis, which is a good thing. So I think for our diagnosis today, we're going to use sore throat. I think this J code is fine enough. And of course, for the, we've got some acute ear pain going on. Let's see what we can find in the system really quickly. And I think that'll work as well. So we actually have the ability to associate those diagnoses where appropriate. And so I've gone ahead and done that. And at this point, all we need to do is accept. All right, so the orders have been signed and things have been taken care of there. Now, for the point of care test, as I mentioned, if I jump back to my schedule, I've got a blue dot now, and that's my indicator as an MA. If that's part of your workflow for them to come in and quickly do that that test, they can certainly do so. But in this instance, I'm just going to stay logged on as the provider and let him handle this scenario for the patient. So we've ordered the test, we've performed the sore throat swab, and we're going to go ahead and enter in the results. So you'll notice here that within the enter edit results activity, my 2 orders are already here. But I just want to result this particular order. So here we've got my order status. I'm going to go ahead and double click. And down below here, I've got my components, so I can certainly just quickly indicate. And before I actually enter in the value, anytime you see a red stop sign with an exclamation point, that is the system letting you know that it is a required field. And with the magnifying glass, it's looking for a category list response. So we'll go ahead and click on that to find out what value it's looking for. So it's a simple positive or negative, and sure enough, that's fine. We are positive for strep. We'll go ahead and look to see what the internal control was. It was acceptable. All right, and then last but not least, you'll notice here I've got a yield sign with another exclamation point. These are not hard stops or required fields except for the recommended. So I might get a pop-up whenever I go to accept my orders. Last but not least, I do see that I need to mark this particular test as final. And so I'll go ahead and do that. We don't expect any edits, any stretch. Go ahead and click accept. Oh, there it is. Recommended fields are empty. Are you sure you want to continue without entering in that information? Yeah, that's okay for today. We'll go ahead and do that. So at this point in time, that result has been documented. And in chart review, as we're going through this process, you'll notice that for underneath the encounters tab, we have access to our office visits. So we're sort of running our narrative, and it's actually indicating and showing us some of the test results as they file. And of course, underneath labs, I'm hoping that I see my POC rapid strep, and of course I do, and I see those results. So all this information is right here at our fingertips, and which is great. And what is great about it is that the ordering and authorizing provider, once this test is final resulted, it also goes to his or her in basket. So if they're not in the chart, it'll give them a little notifier or tickler in the in basket just to let them know, and for them to sign off on the fact that they've seen that result. All right, that takes care of those orders. And we've gone through our edit results. I think now we're ready to start to wrap things up. And we're going to access our plan activity tab just to the right of the rooming tab. If you notice here, we might have some best practice alerts pop up, but we're not going to focus on those for this demo today. We do have problem list, navigator section here on the left-hand side in this 2-pane view. You'll notice that we can actually have the ability to add items to the problem list where necessary, or let's say that we just completely forgot or needed to address or add an additional visit diagnosis. You'll notice here at the very bottom, I have my sore throat and my acute ear pain. I could certainly search the system and add. And if I know that something has been really an issue and we want to add to the problem list, there is an ability to click on the green plus sign underneath the PL column for problem list to quickly add that to the problem list. So it's a nice little time saver. But we're going to leave things as is. We got our visit diagnosis. We do have our meds and orders also accessible from here. We don't have any changes there. At this point, I know I had mentioned this patient's MyChart active, which is super, because one of the key features from a meaningful use quality and objective measures is making sure that we print out an after visit summary. So Hugh might very well ask for us to print out before he or she checks out, the after visit summary. On this particular radio button underneath the plan, we can actually preview the AVS. And we'll see here that it's going to give us a nice synopsis of that particular visit, who they saw, what tests that they had, maybe perhaps any patient's instructions, so on and so forth, and of course, next visit information. But from that perspective, we're not ready to go. We haven't entered in that additional information when it comes to patient instruction. So we want to get you out the door, but we just want to make sure that we've got the pertinent information in the chart so that it does print out on the AVS. Otherwise, if they are MyChart active, there's a nice feature where we don't need to actually print out that copy. At the end of the day, through some back-end processing, their after visit summary for today's visit will actually be sent to them directly through MyChart. So they'll have access to that report, which is, a great qualifier. It helps to check the box off of the meaningful use type of things, as well as making sure we've got that information to our patient. So I did want to mention that as well. All right, so that takes care of our plan. We're going to jump to wrap up. So we did talk about those patient instructions. I just got a nice little feature here for I can actually free text in that I gave maybe the patient some patient instructions regarding sore throat, or there are some nice built-in features or reports. And we've been dealing with sore throat in adults. We're going to go ahead and add that to the patient instructions. There's some good information for you and how to treat himself here as well at home. So we're going to go ahead and we'll run with that as well. So we went ahead and we added our patient's instructions. What I do want to call out is right below patient instructions, there is a charge capture navigator section. So the MA or the physician can actually indicate any additional charges. But, once we've gone through the process of documenting our charges and we drop our LS code, all of those items and those charges will also show up here. So that's just another key navigator section that folks will need to be aware of. Outside of that, for Hugh, we'll just ask him to come back if symptoms worsen or fail to improve. The checkout note feature is a great feature for that provider before the patient exits the rooms and goes to the checkout area. This checkout note would be visible at the checkout station for the checkout area to help to wrap up the visit and accommodate Hugh in any fashion. So, for example, if they want something done and if the provider wants something done in terms of scheduling or next steps, they can actually quickly type that out in the checkout note, and that'll be visible at the checkout. Last but not, so we're not going to go ahead and enter anything there. At this point, we've placed some orders. We've got our note started. One of the key features is when we're documenting our note, and we could be using the smart phrases, or on some occasions, some providers have decided to use Dragon Medical One to also do some high level and some really custom notes. There's a refresh smart link button. And what that does is that it does a quick little system check, and it pulls any other discrete data that I've entered into this encounter, and then make sure it's included in my note. So if you notice here, my order should be popping up. My meds, looks like I've got everything that I need. My impression. So at this point, I'm just going to go ahead and accept my note. I'm going to be happy with that. Now, if I missed any key variables or sections within the note, the system would have prompted me to go back in and correct that. So I think, what, for the most part, we are good with this visit. We've got our patient's instructions. We can send you down the hall. I can finish my note at any point, but this one was pretty straightforward. I'm going to go ahead and sign my visit. Oh, wait. What's this? Okay, so these are some closed visit validation points. I did forget to enter a level of service, so I need to address that. We've got some hyperlinks that are built in, and it's going to bring me to that section I need to complete. So based upon that logic, I'm going to go ahead and enter my level of service for today's visit, and that's going to take care of that. All right, so I've got a level of service. I know the folks in billing are going to be happy with me. and things are cleaned up there. But I also have another requirement to mark sections as reviewed. So I am logged in as the provider. I sort of reminded to refresh my note before signing. We've already done that. But here it gives me an opportunity, and this is once again a CMS and a meaningful use thing, gives me the opportunity to mark as reviewed these sections. And I can see here that the nurse has done this. I'm going to go ahead and make sure I click on mark as reviewed. It's going to tell me that it's good to go, that I can sign my visit. Very simply here at the bottom right-hand side, I can actually click sign a visit, print out another AVS if need be, and we should be set. Any questions, folks?
I see that you put in a non-9212. What if this visit really qualified based on your documentation for a 99215?
There is a nice little feature within the system that allows you to utilize, let's see here, level of service activity. I believe this is our wizard, where you can base it upon time or medical decision making. So we do have those tools built in into the system. So you can make that change. Any other additional questions for me? And it looks like we're refreshed. And you notice here we're back at the multi-provider schedule to wrap things up for Hugh at this point. The encounter is signed, and at this point, depending upon what the clinic might want to decide, you know, we could even use red to indicate that the patient has left the building and that they've been seen. So that's all that I have. If there aren't any other questions, once again, I really appreciate your time. And if something does come up, please feel free to let us know. I'd be happy to research any question you might have. And on that note, I'll hand it back over to you, Marcus.